Thank you, Mr. Chairman, and thank you all so very much for your testimony and for your important work. I think there continues to be a little bit of confusion that has come up with the various members regarding what I think the word that might be causing confusion is the word moving, the Strategic National Stockpile, which is in our draft text of the bill from CDC to ASPR, but as I understand it, discussions and things are still taking place relative to what the roles will be, and I think we all have the same goal, and that is to ensure that all medical countermeasures get to our citizens in the appropriate time and as fast and as efficient as possible. And so for our sake, maybe starting with Dr. Cadillac and then going to Admiral Redd, if we could please talk about where that stands right now, and are there tools or resources you need to effectively carry out the execution of the Strategic National Stockpile for our citizens who expect it to work?
Yes, ma'am.
Dr. Cadillac and then Admiral Redd.
We
just need to clarify and make sure we understand.
Sure, as Dr. Redd identified earlier, there are a number of working groups. I think the key thing is some of them dealt with contracts, and particularly how would the contracts that were been previously administered by CDC be administered by ASPR. And so part of that is kind of, I think the word is novate contracts to ASPR, so that in terms of replenishing the stockpile in the future, so you'd have single oversight of how you would basically develop, procure, and resupply this strategic national stockpile. There are issues around personnel. How many people would be basically transferred to the ASPR and would be the responsibility of the ASPR to basically pay for or provide services to. And then lastly, one of the areas that's still under negotiation is what percentage, if any, of those people who are working with the state and locals would be transferred to ASPR as well. And so that is an area that's further under discussion. The intent is to meet with senior CDC officials later this month to basically hopefully finalize that. But as to this date, there's been no requirement for any legislative language to facilitate the transfer. It's within the Secretary's purview and authorities to do so.
And I think that's what the greatest concern is that local and state authorities, and one of our next witnesses in the next panel expresses that as well. And so we need to make sure that that relationship with whomever is responsible. And I think what I'm hearing you say, though, and I'd like Admiral Redd, you to talk about what you believe the role is and is going to be, because we want to make sure that there is no problem working with state and local officials that actually do the work on the ground.
Yes, ma'am. I think actually Dr. Cadillac summarized the current situation quite well. The areas that I think are critical to just make sure we've got really good clarity on are the role that subject matter experts at CDC will have, both whether or not they're funded by the stockpile now or not, that linkage with the stockpile and with planning, for example, in clinical guidance, how the product should be used, under what circumstances to control or to respond to emerging events, that we've got that part nailed down. And then similarly, the work that we have been doing, partly funded by the stockpile, partly funded by the state and local program, that we've got very good agreement on the work that we're going to continue in that domain to make sure that state and locals are able to dispense products. I think the overall medical countermeasure structure is now more completely under the ASPR, but that state and local role, we think we have a role to support both state and locals and the mission of the ASPR.
And would you agree with that, Dr. Cadillac?
Yes, ma'am, and we also have a role at the state and local level, and we look to figure out how we can best integrate that to provide the best support in state and local.
Well, and I think the integration is the key here, and is trying to ensure that everyone is clear as to what CDC's role is with state and local partners and what ASPR's role is. But it sounds as if the contracting piece and the management of the products, so to speak, and mostly the vaccines, the diagnostic testing, is what would move to ASPR, but yet there will be both agencies will be, or both parts of will be working with state and local health officials. Is that correct? Fair to say?
I think that's the overall intent.
And very briefly, Ms. Abram, my very quick question relative to diagnostic tests and so forth? And can you speak to the role of diagnostic tests, including point-of-care tests, and influence infectious disease detection and management, and how FDA ensures that we have what we need for diagnostic testing? Because it's not just about vaccines, it's also about the diagnostic.
Right. When we think about medical countermeasures, it runs the full gamut of medical products, from vaccines, therapeutics, and of course, diagnostics. And rapid point-of-care of diagnostics is something that also colleagues at BARDA and ASPR are working on. It's absolutely critical, and it's not just critical in the context of emergency response. It's a public health emergency. It's critical as part of good routine care. The sooner you can pinpoint what a patient is dealing with, the faster you can provide optimal care.
Thank you. My time is up. I yield back.
Gentlelady is back, Chair. Thanks. The gentlelady chair recognizes